Going to be giving an IM injection of Rocephin using the Z-Track method. I'm going to wash my hands. I'm going to be giving it by the 6 rights: the right patient, right dose, right route, right time, right date, and right documentation. I'm going to dry my hands. I'm going to check the doctor's order and check that with the MAR as one of my safety checks. The doctor's ordering 1 gram of Rocephin to be given intramuscular using the Z-Track method. I'm going to confirm that with the MAR. That is correct. I'm going to go to the medication dispenser and get out the Rocephin. It's calling for a Practivial solution of diluent. We're going to use the highest concentration so that we can give the lowest volume. That's going to be 500 milligrams per milliliter. To do that, we're going to use 5.6 milliliters of our diluent to get an overall volume in the vial of 6 milliliters. So I'm going to go ahead and open both of my vials. I'm going to open my alcohol swabs, and I'm going to open this vial and clean the top on it. Set that off. I'm going to open this vial and use my alcohol swab to clean it. Get it nice and clean. Let those dry for at least 30 seconds while I prepare my syringe. I'm going to get a 3 ml syringe, and I'm going to leave the needle in there because that's a safety needle, and that's what I'm going to use to inject with the patient with. Pull out my syringe, connect it to. Alright, I'm then going to insert into the medication vial. I'm going to pull out the first 3 milliliters of air from the medication vial. Got 3 mils of air, and I'm going to instill that 3 mils of air into my diluent vial. Rotate and draw up 3 mils of diluent. Got 3 mils of diluent there. Gonna withdraw. Then I'm going to take my alcohol swab and clean the top of this vial. Again, let it dry for a second here. Once it's dried, I will instill the first 3 milliliters of diluent. Makes a funny noise. Then I'm going to withdraw another 2.6 mils of air. And I am going to clean this vial again.
See the face?
Let that dry for about 30 seconds. Then I'm going to push in another 2.6 milliliters of air into this vial. Withdraw 2.6 milliliters of diluent. Got 2.6 mils of diluent. Withdraw the needle. Going to clean this vial once again. Let that dry for a second. Then I'm going to instill the diluent again. Draw the needle. I'm going to set my syringe in that clean surface. I'm going to walk this needle over to the sharps container and throw it away. And then I'm going to slowly rotate the diluent within the medication vial so that I get all of that medication absorbed until it's all, excuse me, until it's all dissolved. All right. I am then going to clean the vial again and connect
I don't want to bang things.
my other needle. I didn't have a needle in it. And I'm going to pull up 2 milliliters of air for the final dose that we're going to be giving. Going to instill that air into the vial, turn it up, and pull out this lovely yellow solution to 2 milliliters for our injection. Okay, so we got 2 milliliters or 1 gram of Rocephin, which was what was ordered. I'm going to take the needle off and walk it to the sharps container. It's relatively close. Then I'm going to put the needle with the safety device on it for doing the injection. Then we're going to take my equipment into the patient's room and my medication. I'm going to bring the vial in case I have to scan it into the room. Hi Bob, it's Bobby again. How are you?
Good.
So the doctor ordered an antibiotic for your infection, and we're supposed to give that in the muscle, and we're going to be giving it in the muscle on your bottom, okay? We're going to have you stand up in a second, and we'll measure you out for that. But first, can I get your name and date of birth?
Bob Johnson, 4/12/70.
4/12/70, that checks out. I'm going to check that with the MAR. That checks out. Do you have any allergies, Bob?
Nope.
I'm going to scan the patient's bracelet, scan the medication so it comes up. I'm going to double check that with the medication that I have in my hands. We're asked to give 1 gram or 2 milliliters of this solution, intramuscular using the Z-Track method. So I'm going to set that off to the side. When I go to give it, I'm going to find the prominence here and have the patient squeeze, and then I'm going to go on the dimple where my finger comes up and give that injection at 90 degrees. First I'm going to wash my hands. Then I'm going to put on my gloves.
I want to come with you.
And I'm going to have Bob stand up if he's able to, so that I can give it right here. That way we don't get this lovely yellow solution on this clean hospital bed. Unfortunately, we're going to have to give it on this surface for the time being. So I'm going to find that location again on Bob, and I'm going to cleanse the site using a circular motion. Let me throw that. Oh, put that right there for now. All right, and then I'm going to let that dry for 30 seconds. And once it's dry, it's been about 30 seconds now, I'm going to remove the needle, and I'm going to use the Z-Track method. So I'm going to pull the skin over 1 to 1.5 inches. I'm going to give the injection at 90 degrees going in. I'm then going to aspirate for blood for about 5 seconds. Got no blood return, so I'm going to give the medication gently. I'm then going to remove the needle and let the skin go back into place, and I'm going to set that piece of gauze on there. Bob, you go ahead and hold that for me for a second. I'm going to safe my needle.
Okay.
And I'm going to put it in a sharps container. How'd that go, Bob?
It was alright. Kind of hurts though.
Oh, I bet. Alright, and so if it bled anymore, I would continue to blot at it. I wouldn't rub. I'd help Bob back into bed. There you go, Bob. Then I'm going to document it in the MAR that I gave Rocephin, 1 gram on the left ventrogluteal, and the patient's reaction to it. Is there anything else I can do for you, Bob?
Nope, that's all.
All right, we'll see you here in a little bit.
Okay.